Welcome to Nexus Clinical. Before diving into this lecture, I want to ensure we're all on the same page. This is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient or pharmacist-patient relationship is formed. Using this information and the materials linked to this content is at the user's risk. This is not intended to substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay seeking medical advice for any medical condition they have, and they should consult their healthcare professionals for any such conditions. Clinical experts created the references, content, and clinical insight. NotebookLM, a Google AI tool, created the content, which I extensively reviewed before release. Finally, the host states that he takes all conflicts of interest seriously. Currently, there are no conflicts to disclose. For all of his disclosures and the companies he invests in or advises, he directs users to reach out independently, where he keeps an up-to-date and active list of all disclosures.
Toxicology is a fascinating field with a rich history that has transformed from mystical practices to a scientific discipline. It highlights important figures like Paracelsus and Orfila and examines the growth of poison control centers and the influence of the elixir sulfanilamide disaster on drug regulation. The course covers core principles such as pharmacokinetics and toxicokinetics and offers guidance on evaluating and treating toxicology patients. Topics include various toxic syndromes, activated charcoal, and sorbitol. It also discusses current challenges and opportunities, making it a relevant and engaging area of study. This semester provides a thorough overview of essential toxicology topics. It aims to improve your practice and deepen your understanding to offer the best care to those affected. By the end, you'll feel confident and well-equipped to manage a wide range of toxicology cases. In today's lecture, we will discuss some of the foundational aspects of toxicology. By the end of the session, you will understand the historical development of toxicology, tracing its origins from mystical beliefs to a recognized scientific discipline. Additionally, you will learn about the evolution of poison control centers, which have transformed from simple information hubs for physicians into significant public health institutions. The lecture will also cover the impact of the elixir sulfanilamide disaster on drug regulations in the United States, highlighting how it influenced policies governing pharmaceuticals. You will be introduced to the challenges and opportunities facing the field of toxicology in the 21st century. Furthermore, the session will involve applying principles of toxicology patient evaluation, including conducting initial assessments and managing life-threatening issues. We will discuss the use of activated charcoal and sorbitol in treating acute oral overdoses, focusing on their effectiveness and safety concerns. Finally, I will explain the principles of pharmacokinetics and toxicokinetics, emphasizing the processes of absorption, distribution, metabolism, and excretion of toxins. You will also learn to recognize and differentiate common toxic syndromes based on their characteristic clinical features. The development of toxicology as a scientific discipline challenged traditional beliefs about poisons and poisoners by shifting from a mystical and superstitious understanding to a rational, scientific, and experimental approach. For centuries, poisons were believed to possess mystical properties, with their use often surrounded by superstition and intrigue. Ancient toxicologists, who were frequently magicians, sorcerers, or religious figures, relied more on rituals and beliefs than on scientific methods. The quest for a universal antidote, exemplified by remedies such as Mithridatum and Theriac, underscores this reliance on magical thinking. These mixtures, which contained numerous ingredients and were promoted as cures for all poisons and ailments, remained in use for centuries despite lacking any scientific evidence of their effectiveness. A pivotal figure in the history of toxicology was Paracelsus, a Renaissance scholar who marked a turning point in the field. His focus on the relationship between dose and response revolutionized the understanding of poisons, shifting attention to their chemical nature and emphasizing the importance of observation and experimentation. In the 18th and 19th centuries, the field of toxicology emerged as a distinct scientific discipline. Pioneering researchers such as Felice Fontana advanced this development by employing rigorous experimental methods, exemplified by his investigations into viper venom. Bonaventure Orfila, recognized as the father of modern toxicology, further established the scientific foundation of the discipline. He promoted the use of chemical analysis and autopsies as evidence in legal proceedings, thereby laying the groundwork for the practice of forensic toxicology. Developing analytical techniques for poison detection also played a crucial role in challenging traditional beliefs. The reliance on symptoms for diagnosing poisoning was replaced by more reliable chemical assays, especially for commonly used poisons such as arsenic. The work of scientists James Marsh, Hugo Reinsch, and Max Gutzeit led to the development of vital assays that transformed forensic toxicology. The Marsh test, for example, was instrumental in Marie Lafargue's trial in 1839, demonstrating the significant power of scientific evidence in contesting traditional notions. The shift towards scientific toxicology also affected how poisoners were perceived. In the past, poisoners were often seen as mysterious figures possessing arcane knowledge. However, this view gradually changed to a more scientific perspective. The establishment of poison control centers and the rise of medical toxicology played a significant role in this transition by emphasizing public health initiatives and preventative measures. As a result, public understanding of poisoning evolved from sensationalized stories about poisoners to a more rational approach, recognizing poisoning as a public health issue. The elixir sulfanilamide disaster of 1937 was a tragic event that resulted in the deaths of over 105 people who had taken a sulfanilamide preparation dissolved in diethylene glycol. This incident serves as a powerful reminder of the vital importance of drug safety testing and regulation. The tragedy prompted significant changes in United States drug laws and highlighted the need for strict safety measures. Before this event, drug manufacturers in the United States operated with minimal oversight regarding the safety of their products. The Pure Food and Drug Act of 1906 primarily aimed to prevent adulteration and misbranding of food and drugs rather than enforce safety testing. The Food and Drug Administration was established in 1906 to enforce this act. While there were efforts to strengthen regulations, these had not yet been enacted by 1938. The incident involving the sulfanilamide preparation was a catalyst for change. The widespread fatalities caused by the toxic solvent diethylene glycol revealed the severe consequences of inadequate drug safety protocols. Public outrage, fueled by the scale of the tragedy, demanded immediate action. This disaster also exposed the lack of understanding about the toxicity of excipients and diluents used in drug formulations. The assumption that diethylene glycol, a common solvent at the time, was safe for human consumption proved to be tragically incorrect. The elixir sulfanilamide disaster was a pivotal event in the history of drug regulation, marking a significant turning point that led to the enactment of the Federal Food, Drug, and Cosmetic Act of 1938. This legislation introduced mandatory safety testing for new pharmaceuticals before they could be marketed, greatly enhancing the authority of regulatory agencies. It shifted the focus from merely preventing misbranding to ensuring the safety and effectiveness of drugs, representing a paradigm shift in United States drug regulation. The tragedy underscored the necessity of rigorous scientific evaluation prior to the release of medications. Its impact extended beyond national borders, highlighting the urgent need for international cooperation to establish safety standards in the global pharmaceutical industry. Despite this, the harmful practice of using diethylene glycol as a diluent persisted in some countries, leading to additional poisoning incidents in South Africa, India, Nigeria, Bangladesh, and Haiti. These events demonstrate the ongoing challenge of safeguarding drug safety worldwide. The disaster and its global repercussions emphasize the importance of continuous learning from past tragedies to prevent similar occurrences in the future. Such ongoing improvement is essential to maintaining high standards of drug safety. Overall, The events of 1937 and their aftermath serve as a powerful reminder of the critical importance of stringent safety protocols, which continue to protect public health today. The origins of poison control emerged as a response to a growing public health crisis. After World War II, the increase in new chemical substances and the recognition of suicide as a major issue highlighted the need for coordinated efforts to manage poisoning cases. European countries responded by establishing specialized wards dedicated to toxicology and poison information services. In the United States, a study conducted in 1952 by the American Academy of Pediatrics found that more than half of childhood accidents involved unintentional poisonings. This significant finding led to the creation of the first Poison Control Center in Chicago. Early centers primarily served as resources for physicians, especially pediatricians, offering ingredient lists, toxicity data, and treatment recommendations. This focus was driven by the challenge individual physicians faced in staying updated with the increasing volume of product information and treatment protocols. As more centers were established, their roles expanded beyond aiding physicians to include handling calls from the general public. This broadening of responsibilities underscored the need for a centralized system, as each center independently compiled product information, leading to redundant efforts. The National Clearinghouse for Poison Control Centers was established in 1957 under the Food and Drug Administration. Its goal was to streamline operations and standardize information resources across centers. The clearinghouse distributed index cards containing poison information to each center and began collecting data on poison incidents. This effort laid the foundation for a national poison surveillance system. Between 1953 and 1972, there was a rapid and largely uncoordinated expansion of poison control centers across the United States. This growth raised concerns about the quality and consistency of the services provided. The formation of the American Association of Poison Control Centers in 1958 was a significant milestone in the professionalization of the field. It helped establish uniform standards and educational programs for poison control. The organization also played an important role in advocating for important legislative initiatives, including the Federal Hazardous Substances Labeling Act of 1960, the Child Protection Act of 1966, and the Poison Prevention Packaging Act of 1970. In 1972, microfiche technology was introduced, enabling the storage and retrieval of large volumes of data. This advancement significantly enhanced the informational capacity of poison control centers. Databases such as Toxifile and PoisonDex, which initially used microfiche, later transitioned to CD-ROM technology. These developments revolutionized access to poison information, making data on even the most obscure xenobiotics readily available. In 1978, the American Association of Poison Control Centers established standards for the designation of regional poison control centers. This marked the beginning of a new era characterized by increased professionalism and the standardization of services. The criteria prioritized around-the-clock operation by dedicated poison specialists serving regions with populations ranging from 1 to 10 million. This approach helped drive the consolidation of centers and enhanced the quality of services provided. In 2000, the Poison Control Center Enhancement and Awareness Act secured federal funding aimed at poison prevention and the operations of these centers. This legislation led to the creation of a nationwide toll-free telephone number and the establishment of a comprehensive national poison database. The modern role of poison control centers extends beyond managing acute ingestions. While unintentional poisonings among children remain a significant concern, these centers have broadened their scope to address a wide variety of toxic exposures. These include both acute and chronic cases affecting both adults and children, as well as unintentional and intentional incidents, along with exposures related to occupational and environmental hazards. Since the recognition of medical toxicology as a formal subspecialty in 1992, the role of poison control centers has evolved significantly. Medical toxicologists now routinely participate in the operations of these centers and contribute to public health initiatives. Furthermore, the increasing emphasis on environmental toxicology and a greater awareness of environmental hazards have further expanded the responsibilities of poison control centers. They now play an integral role in addressing public health concerns tied to environmental toxins. Challenges include the widespread distribution of toxic chemicals due to globalization, which complicates tracking and regulation efforts. There is a significant concern about the potential misuse of these chemicals by terrorists or others intending harm. Industrial accidents, such as those at Bhopal, Chernobyl, and Minamata Bay, exemplify the potential for environmental disasters and the long-term health consequences of exposure to toxic substances. To mitigate these risks, continuous efforts in environmental monitoring and regulation are essential. The opioid crisis presents a serious public health challenge. Toxicology is crucial for understanding how opioids cause toxicity, developing effective antidotes, and educating the public about the dangers associated with drug abuse. Occupational toxicology remains relevant as workers in various industries face exposure to hazardous substances. Ensuring safety in the workplace, monitoring employee health, and creating strategies to prevent occupational illnesses are vital. Incidents of food contamination with chemicals like melamine and hexachlorobenzene highlight the importance of strict food safety regulations and monitoring systems to protect public health. The use of chemical agents such as sarin gas in terrorist attacks, such as the Tokyo subway incident, underscores the threat of chemical weapons and the need for toxicology to develop countermeasures, treat victims, and prepare for future incidents. Researching the effects of toxic substances on humans involves ethical challenges. Toxicologists must carefully balance the pursuit of knowledge with the safety and well-being of individuals involved in their studies. Opportunities in toxicology and related fields are expanding rapidly due to scientific progress in genetics and material sciences. New disciplines such as toxicogenomics, precision medicine, and nanotoxicology have emerged, offering promising avenues for understanding the molecular mechanisms underlying toxicity. These fields aim to develop more accurate biomarkers that can predict toxic effects and enable personalized drug therapies to enhance efficacy and safety. Additionally, they address the unique challenges presented by nanoparticles. Toxicology itself is continually evolving, with advancements in analytical techniques, antidotes, and treatment approaches. These innovations improve the diagnosis and management of poisonings and other toxic exposures. The discipline also plays a crucial role in public health initiatives. Poison control centers, environmental monitoring programs, and food safety efforts all depend on toxicological expertise to protect the public from harmful substances. Raising public awareness about the dangers of toxic substances, promoting poison prevention strategies, and advocating for stricter regulations are vital steps toward reducing the impact of toxic exposures. Furthermore, addressing the global nature of chemical production, distribution, and use requires international cooperation. Sharing information, expertise, and resources among countries can strengthen efforts worldwide to mitigate the risks associated with harmful chemicals. The evaluation of a toxicology patient begins with addressing life-threatening issues similar to any severe medical situation. These critical concerns include airway compromise, breathing difficulties, and circulatory problems such as hemodynamic instability and serious irregularities in heart rhythm. Once the patient's airway, breathing, and circulation are stabilized, the next step involves assessing their level of consciousness. This assessment helps determine the appropriate management steps for the exposure. Additionally, evaluating the patient's mental status and exposing them to identify any unknown injuries are essential parts of emergency medicine. For patients with altered mental status, it is essential to ensure airway patency and assess the adequacy of breathing. If irregular or slow breathing patterns are present, especially with elevated end-tidal carbon dioxide, 100% oxygen should be administered using a bag valve mask. Endotracheal intubation and mechanical ventilation may be necessary to maintain airway control and enable the safe performance of medical procedures. Oxygen saturation should be checked using pulse oximetry, and blood gas analysis, either arterial or venous, should be considered, including measurements of carboxyhemoglobin and methemoglobin levels. An immediate bedside test to determine blood glucose concentration is crucial to rule out or address hypoglycemia. The patient's pulse rate and rhythm, blood pressure, and rectal temperature must be assessed. Conducting a 12-lead electrocardiogram and continuous rhythm monitoring is important to identify dysrhythmias, which can help anticipate potential complications and guide treatment decisions. Any extreme body temperatures should be addressed promptly. Hyperthermia, defined as a temperature above 106 degrees Fahrenheit or 41.1 degrees Celsius, requires immediate cooling measures such as appropriate sedation, immersion in ice water, or other cooling techniques. Recognizing hypothermia early is equally important to prevent administering medications that might become toxic during subsequent warming. In cases of hypotension with clear lungs, an intravenous fluid challenge using a solution of 0.9% sodium chloride or lactated Ringer solution should be administered. If hypotension persists or if fluids are not tolerated, consider using antidotes, vasopressors, or inotropes, along with invasive interventions if necessary. When starting an intravenous line, it is important to collect blood samples for glucose levels, electrolyte measurements, blood, urea nitrogen, a complete blood count, and any necessary toxicological analyses. For women of childbearing age, a pregnancy test should also be performed. In cases where there is a concern about possible suicidal intent, an acetaminophen concentration should be obtained. Additionally, tests for specific xenobiotics may be indicated based on the patient's history, physical examination, or bedside diagnostic tests. These tests could include measurements of carbon monoxide, lithium, theophylline, iron, salicylates, and digoxin, or other cardioactive steroids. It is important to recognize that routine metabolic profile tests, such as complete blood count, blood urea nitrogen, glucose, electrolyte levels, liver function tests, and blood gas analysis, are often more useful than toxicological assays in diagnosing toxicological emergencies. Manage seizures based on their category. For standard treatment, benzodiazepines are usually used as antiepileptic agents. In cases of specific poisoning, such as seizures caused by isoniazid, administer the appropriate antidote, like pyridoxine. When the underlying cause is identified, such as carbon monoxide poisoning or hypoglycemia, address it accordingly. When assessing a patient with altered mental status, administer certain treatments empirically unless contraindicated. First, give thiamine at a dose of 100 milligrams intravenously. Ensure adequate oxygenation. Provide glucose, specifically 50 milliliters of dextrose in water for adults or 2 milliliters per kilogram of body weight in dextrose in water for children. If opioid overdose is suspected and respiratory compromise is evident, administer naloxone starting at 0.04 milligrams intravenously, titrating the dose upward as needed. Remember that hypoglycemia can be the sole or contributing cause of coma, even with focal neurological findings. Only exclude dextrose administration after confirming normal blood glucose levels with accurate bedside testing. Always consider the possibility of trauma in patients presenting with altered mental status and vice versa. A thorough physical examination is essential, including observation for abnormal posturing such as decorticate or decerebrate posturing, abnormal or unilateral withdrawal responses, pupil size and reactivity, nystagmus, abnormal reflexes, and focal neurological signs. It is also important to note characteristic breath or skin odors that may indicate the ingested substance. In patients with a normal mental status, vital signs should be obtained and recorded with particular attention to respiratory rate and rhythm. A detailed history should be gathered, recognizing that the information provided may be unreliable. In such cases, consulting a friend or relative can help, ensuring compliance with health information privacy regulations. A focused physical examination should include assessment of the lungs, heart, abdomen, and a neurological survey. For patients with intentional exposures, establishing rapport and explaining the necessary procedures is crucial. It is important to remember that resistant patients can increase the risks associated with gastrointestinal decontamination. When managing pregnant patients, the primary focus should be the optimal care of the mother. Recognize that signs of low blood pressure may develop later due to increased blood volume during pregnancy, and take measures such as maintaining the patient in a left lateral decubitus position to prevent low blood pressure related to lying on the back. Additionally, consider the typically lower levels of carbon dioxide in blood gas interpretations during pregnancy. Antidotes should be used cautiously, weighing the potential risks and benefits for both mother and fetus. Patients exposed through the skin should be protected by wearing appropriate gear to prevent secondary exposure. Remove contaminated clothing and seal it in plastic bags. The patient should be washed with soap and water twice. Efforts to neutralize acids or bases should be avoided, as this can cause further tissue damage. Application of creams or greasy substances should also be avoided. In cases of eye exposure, irrigate the eyes with normal saline for at least 20 minutes while fully retracting the eyelids. Using an anesthetic eye drop and eyelid retractors can facilitate this process. The eyelid fornices should be checked with pH paper strips to ensure adequate rinsing. In situations involving exposures that are not toxic, unnecessary treatment should be avoided to prevent potential harm. Patients with exposures that are questionable should be referred to a poison control center or healthcare facility for further assessment. When determining disposition, the appropriate level of care depends on the patient's condition, the type of exposure, and the resources available. Critical care unit admission should be considered for patients experiencing severe organ toxicity, those at high risk for complications, or those needing unconventional therapies. Achieving the best outcomes involves applying both basic and advanced principles of life support, following a planned, stepwise approach, and modifying protocols as necessary. Consultation with a poison control center, medical toxicologist, or clinical toxicologist is valuable. It is also important to understand that laboratory tests may not always detect the specific poison involved. Remember that patients with a suspected overdose or poisoning who present with altered mental status pose complex challenges. Special considerations are necessary for pregnant patients, as well as those with toxic exposures affecting the skin or eyes. Additionally, patients whose histories are limited or unreliable, such as those involving self-harm, illicit drug use, or unknown exposures, require careful attention to their circumstances. Activated charcoal effectively reduces the absorption of many xenobiotics and can enhance their elimination by interrupting enterohepatic or enteroenteric cycles. It is regarded as the most helpful management strategy for patients experiencing acute oral overdoses. The effectiveness of activated charcoal decreases over time, providing the greatest benefit when administered within 1 hour of ingestion. The recommended dose for adults is 50 to 100 grams, which corresponds to approximately 1 gram per kilogram of body weight. For children, the dosage ranges from half to 1 gram per kilogram of body weight. Activated charcoal has a gritty texture and tends to stick in the throat. It is black in appearance and has a bland taste, making it unappealing to many patients. Various efforts have been made to improve its palatability by adding flavors, including sorbitol. Other flavoring agents that have been used include chocolate syrup, cherry extract, cookies, juice, saccharin, and strawberry flavor. Sorbitol is commonly used as a sweetener and flavoring agent, including in preparations containing activated charcoal. However, several safety concerns are associated with its use. Multiple doses of sorbitol can lead to hypernatremia due to unreplaced stool water losses caused by its diarrhea-inducing effects. This can result in severe dehydration and even death in both children and adults. The adverse effects include depletion of salt and water, hypotension, and potentially fatal electrolyte imbalances, especially in children. Severe gastrointestinal effects, such as salt and water depletion, have been reported. Sorbitol is also linked to intestinal paralysis, known as ileus, and intestinal obstruction, which can sometimes lead to perforation. When sorbitol is retained in the intestines after repeated doses, it may cause significant health complications. These arise from gas formation and abdominal distension resulting from the digestive activity of gut bacteria. The use of activated charcoal combined with sorbitol is not recommended for children under the age of 1 year due to their increased vulnerability to dehydration and electrolyte disturbances. Additionally, the package insert for activated charcoal with sorbitol advises against administering it to patients with a hereditary inability to metabolize fructose. This is because sorbitol is processed in the liver into fructose. Pharmacokinetics is the study of how the body interacts with foreign substances, including the processes of absorption, distribution, metabolism, and excretion. Understanding these processes is essential in toxicology for predicting when toxicity will occur, how long it will last, and how severe it might be, as well as guiding effective treatment strategies. Absorption refers to the process by which a foreign substance enters the bloodstream. For a substance to have effects throughout the body, it must first be absorbed and reach its target sites. The rate at which absorption occurs and the extent to which it happens are critical factors that influence toxicity. Several factors can affect absorption, including the formulation of a substance, such as tablets, capsules, or liquids. The lipid solubility of the substance, indicated by the partition coefficient, plays a significant role in its ability to cross cell membranes and be absorbed. Other influences include the time it takes for the stomach to empty, the presence of food in the gastrointestinal tract, and the pH level within it. Some substances are absorbed through active or facilitated transport mechanisms, which can become saturated and are susceptible to interactions with other drugs. Bioavailability measures the proportion of the administered dose that reaches the systemic circulation unchanged. It is determined by comparing the area under the plasma concentration versus time curve following administration through a specific route, such as oral, to the area under the curve following intravenous administration, which is considered to represent complete bioavailability. First-pass metabolism occurs when a substance is metabolized in the liver before reaching systemic circulation. This process can significantly decrease bioavailability. In cases of overdose involving extended-release formulations, absorption may be delayed and prolonged, which can complicate clinical management. Distribution refers to the process by which a xenobiotic is transported from the bloodstream to various tissues and organs. Organs with higher blood flow, such as the heart, brain, liver, and kidneys, receive the xenobiotic more rapidly. Xenobiotics can bind to plasma proteins like albumin, but only the unbound or free fraction is pharmacologically active and available for distribution. Additionally, xenobiotics may bind to proteins within tissues, which influences their distribution and the potential for toxicity. Certain barriers such as the blood-brain barrier, placental barrier, and blood-testis barrier restrict the entry of specific xenobiotics into these sensitive areas. Specialized proteins play a crucial role in facilitating the movement of xenobiotics across cell membranes, thereby affecting their distribution and elimination. The volume of distribution is a theoretical parameter that describes the extent of a xenobiotic's distribution within the body. It is calculated by dividing the dose administered by the initial plasma concentration. A high volume of distribution indicates that the xenobiotic is extensively distributed into tissues, whereas a low volume suggests that it remains primarily confined to the plasma. Metabolism, also known as biotransformation, is the process by which the body chemically modifies xenobiotics. This process primarily aims to increase their water solubility, making it easier for the body to excrete them. The liver serves as the main site for xenobiotic metabolism. The metabolism of xenobiotics generally occurs in 2 stages. The first stage involves reactions such as oxidation, reduction, and hydrolysis, which are often catalyzed by enzymes from the cytochrome P450 family. These reactions typically introduce or expose functional groups on the xenobiotic molecule, resulting in a more polar compound. The second stage involves conjugation reactions, where a polar molecule, such as glucuronic acid, is attached to the xenobiotic. This attachment further enhances its water solubility. Through this metabolic process, a xenobiotic can be detoxified, becoming less harmful, or it can be bioactivated, which may produce toxic effects. Excretion is the process by which xenobiotics and their metabolites are eliminated from the body. These substances are filtered by the kidneys and expelled through urine. The liver also plays a role by secreting xenobiotics and their metabolites into bile, which then enters the intestines and is ultimately expelled in feces. Additionally, minor routes of excretion include the secretion of substances through sweat, saliva, tears, and breast milk. Toxicokinetics involves the study of how xenobiotics are absorbed, distributed, metabolized, and excreted under conditions that can induce toxicity. During overdose situations, the normal pharmacokinetic processes may be altered, which can lead to unpredictable toxic effects. Clearance refers to the volume of blood from which a xenobiotic is entirely removed per unit of time, serving as a measure of how efficiently the substance is eliminated from the body. The half-life of a xenobiotic is the amount of time required for its concentration in the plasma to decrease by half. This parameter is essential for understanding the duration of the xenobiotic's effects and for designing appropriate dosing regimens. Steady state is reached when the rate at which the xenobiotic is taken into the body equals the rate at which it is eliminated, resulting in a stable concentration within the plasma. Factors influencing pharmacokinetics include age-related physiological changes that can significantly impact drug absorption, distribution, metabolism, and excretion. Obesity can alter the volume of distribution and clearance of certain xenobiotics, often requiring dose adjustments. Hormonal differences between males and females may influence how drugs are metabolized and eliminated from the body. Genetic variations in enzymes responsible for drug metabolism and transporters can lead to considerable differences in drug response and toxicity among individuals. Additionally, liver and kidney diseases can impair the processes of drug metabolism and excretion, making careful dose adjustments necessary. When multiple drugs are administered concurrently, interactions can occur that alter absorption, distribution, metabolism, or excretion, potentially resulting in unexpected toxicity or therapeutic effects. We have explored the fascinating evolution of toxicology from its mystical origins to its current status as a vital discipline dedicated to public health. Early understandings of poisons were rooted in superstition and folklore, but over time, scientific approaches challenged these beliefs and introduced rational experimental methods. Pioneers such as Paracelsus Fontana and Orfila played crucial roles in this transition by emphasizing the importance of dose-response relationships, chemical analysis, and rigorous testing. The development of analytical techniques revolutionized forensic toxicology. For example, the ability to detect specific poisons like arsenic through tests, such as the Marsh test, shifted investigations from reliance on subjective symptoms to objective scientific evidence, significantly impacting legal proceedings. After World War II, poison control centers emerged in response to increasing cases of poisoning. These centers initially focused on providing information to physicians, but soon expanded their roles to include public education and preventative measures. Technological advancements, including microfiche and databases like Toxifile and Poisondex, greatly improved their capacity to disseminate vital information. The tragic elixir sulfanilamide disaster of 1937, which resulted in over 105 deaths due to a toxic solvent used in a medication, underscored the urgent need for drug safety regulation. This catastrophe led to the enactment of the Federal Food, Drug, and Cosmetic Act of 1938, which mandated pre-market safety testing of new medications and enhanced the regulatory authority of the Food and Drug Administration. In the 21st century, toxicology faces new challenges such as globalization, environmental toxicity, substance abuse, and potential chemical misuse. Nevertheless, emerging fields like toxicogenomics and nanotoxicology present exciting opportunities for better understanding and mitigating these risks. Overall, toxicology continues to play a vital role in protecting public health. Its ongoing evolution, driven by scientific innovations and a commitment to addressing emerging threats, ensures that it remains an essential discipline dedicated to safeguarding human health amid increasing complexity.
This was an episode of the Nexus Clinical Podcast. This is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient or pharmacist-patient relationship is formed. Using this information and the materials linked to this content is at the user's risk. This is not intended to substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay seeking medical advice for any medical condition they have, and they should consult their healthcare professionals for any such conditions. Clinical experts created the references, content, and clinical insight. NotebookLM, a Google AI tool, created the content, which I extensively reviewed before release. Finally, the host states that he takes all conflicts of interest seriously. Currently, there are no conflicts to disclose. For all of his disclosures and the companies he invests in or advises, he directs users to reach out independently, where he keeps an up-to-date and active list of all disclosures.